Thanks, Christy. And Dr. Stephen Thomas from Upstate University Hospital back with us, joining us now. And we've got a bunch of questions. Thank you again for coming in. I know you have busy days. You were at the County Executive's press conference this afternoon. We talked about this last week, but the number of positive cases have gone up quite a bit, as expected. But a lot of people are wondering, is Upstate University Hospital, and I know you can only speak for them and not other hospitals and other healthcare institutions, the number of beds and ventilators? I think you said in the press conference we're green. What do you mean? How green is green with that?
It's green. So yeah, in terms of the number of medical surgical beds, in terms of the number of intensive care unit beds, in terms of the number of staff, ventilators, we are green, so we are good. This is a very fluid situation. Obviously, we had 45 cases right now in Onondaga County. There is every expectation that that number is going to increase. So, you know, we are constantly planning, and we are poised to, you know, meet the request of the governor to put a plan in place to, you know, excel up to 50% of our normal occupancy, and then an ultimate goal of 100%.
How do you do that? So the governor, if people didn't know, the governor issued an executive order today requiring hospitals across the state to increase their bed capacity by 50%. He said, we'd love to get to 100, but at least 50. So how do you do that at the hospital? I'm sure you're maxed out to some degree already.
Yeah, so one of the things that you can do is what we've already done, which is all non-essential surgeries, surgical procedures, any kind of non-essential medical appointments that would have resulted in an inpatient stay. Those, if they have been safe, have been pushed, and that's a decision that the medical provider and the patient has to make. And then there's other innovative ways to utilize the space that you have in the hospital, and then there's other ways to look at space that is outside of the hospital that could be converted into a medical care environment.
I mean, right now in Onondaga County, the number of people that's tested positive that are in the hospital is relatively low, even percentage-wise, right? But we've got to be ready for that curve to jump up at any minute, right?
Right. So as the county executive had mentioned, the number of positive tests compared to the number of tests that have been completed is about 4%. There is every expectation that that number is going to increase. You know, we're hearing some numbers from downstate where the number has been 20%, 30%, 40%. We hope that if people can adhere to a strict you know, social distancing policy, that number can stay relatively where it is, but we'll see.
Let's talk about that since you brought it up. I mean, we've heard it over and over, stay at home. And that goes for everybody. Stay at home if you're non-essential, and that's a lot of people. I mean, why do we keep saying that? And these are orders. This is not a suggestion. These are orders from the governor to the county executive. Why is that so important for people to do? And what does it mean when we say stay at home? Doesn't mean get everybody together and have a neighborhood party, does it?
No, it means the exact opposite. It means your family unit is home. You're going to all be around one another. That's fine. We're talking about no play dates, limiting any kind of, if you go outside, maintaining 6 feet if you pass people, you know, during your walk. What people need to understand is that the length of time that this is going to take will be directly related to people's level of compliance with what the governor and what the mayor and what the county executive are asking people to do. If you do not take this seriously, then you are just going to continue to perpetuate transmission of the virus within our community, which is going to potentially hurt people from a medical standpoint. It's going to hurt businesses. It's going to hurt everything. So for people who don't take this seriously, you're impacting other folks.
And I've seen, and it's great to see this weekend, so many people that I've never seen before out walking. When we're walking, if it's not a close family member, I mean, the expectation is still social distance, right? It doesn't mean just because you're outside, you're good if you're with your neighbor.
No, that's exactly right. And so I had a personal experience this weekend. I was walking up to a group of people. They had formed a box with 6 feet in between each of them, and they were talking and having a conversation and enjoying one another's company while maintaining a social distancing posture. It was perfect, and that's how it should be.
I thank you so much, Dr. Thomas. You're always so kind with your time. I know you're a busy man. Thank you for coming in. I'm sure we'll have you back very soon again. For all your COVID-19 related questions, all you have to do is take a look at your screen here. We've got a list there of the phone numbers. There's many of them. Upstate Triage Line. You're worried about whether you're showing some symptoms. Senior Help Hotline. You need help getting groceries. Number for Child Care Solutions. And, of course, the number for Volunteer CNY. And, of course, we've got all that for you at localsyr.com and the News Channel 9 app. Christy?